You call them artery, capillaries, and veins. So the arteries, A for OA, they deliver blood away from the heart. Your veins, IN, they return the blood back into the heart. And then the capillaries are the ones you see. Look at this picture. Remember this when you answer the test, okay? Only the capillaries have pores or openings. Sometimes some capillaries have actual spaces in between the cells. That's how substances are able to leave and enter your circulation. Where do white blood cells leave? Here. How about your glucose? How does it leave to nourish your here? Hormones here. Never here, never here. This one has no openings. Okay? So we will another thing about your capillary. Of the three blood vessels, only the capillaries is made up of just epithelium. It's just one cell layer thick. And the simplest, thinnest epithelium called simple squamous. Very good. Simple squamous epithelium. That's it. So let's look at your arteries. They compare, so this is another picture over here, another slide I mean. We compare our artery with the vein and the capillary. See, the capillary is just made of endothelium, which is epithelium, simple squamous epithelium. That's it. And it makes sense. This is where exchange happens. So let's look at the artery first. Whether it's artery or vein, you see they're comparing the two. They have three layers. Both of them will have three layers. An internal layer or tunica intima. You don't need to memorize. I hope you just remember. Internal, middle layer, and outer layer. Will you remember that? Tunica intima or interna is the internal. Tunica media is medial layer, middle layer, and then the tunica externa is the outer layer. What is the inner layer made of? This is the epithelium. So it's just one continuous. You see, it continues, it becomes artery. See, when you get to it's just branching, okay? So the artery, when it becomes smaller, it's just one and the same blood vessel. It's one and the same. It's not it it just when it loses the other layers, then you change the name to capillary, and then as it returns the blood back to the heart, because the muscle layer in the vein becomes thinner, then you call it vein. Another difference between artery and vein. Veins have a valve. Look at this valve in veins. You remember I told you? And when you open up the heart, look at the valve in the veins. And so I want you to look for a vein in your cat. And look at the valve. Hopefully you can find a vein in the cat. Very easy to find uh, uh, your artery, but vein, very hard for some students, okay? And look for the vein in your lower extremities, the bigger one, femoral vein. And try to open that up and compare the valve here with the valve in your heart. The valve in your heart is actual connective tissue. What is this? Look at this one. What is this? It's a continuation of your, what's this? Epithelium. And so the veins of your valve is nothing but modified epithelium. Which one is stronger? The heart valves or the vein valves? Heart valves. And because of that, it's easy to have varicose veins. Okay? Because can that is that as strong as your no, it's not. It's just modified epithelium. We're going to study the implication of that one. Let's look at the artery first, okay? So it's one and the same vessel, see? Then go to the heart. You just change names because it just starts looking different. You should be able to identify under the microscope which one is an artery. An artery, because of the thick muscle layer, is able to retain its shape. And you see that elastic lamina, the elastic fibers? Veins do not have that, and veins collapse. When there's no blood in there, it collapses. So see how the diameter is, the lumen collapses compared to the artery. And the one thing about artery, it has that elastic fiber. Okay? So be sure you know how it looks like. So we go back to arteries. Arteries, as far as arteries is concerned, see, they have, because of the elastic layer, they have this elasticity. So this term vasoconstriction, vasodilation only applies to the arteries. I'm going to draw the heart here. There's my artery. There's my vein. There are problems that's unique to arteries only, problems unique to veins only. When you see the word aneurysm, what is aneurysm? So, what is it? It's okay, very good. Because what happened to an aneurysm? There is first it bulges, right? So which of the blood vessels will bulge? It must be. Do you think artery or vein? No, artery. Okay, because very good Confucius. Remember that arteries have these elastic fibers. Then elastic fibers stretch. Okay? So look at this heart over here. Which of the two blood vessels receive the blood from the heart? The artery, right? So it makes sense that the artery has the elastic fibers. And you remember elastic fibers, they stretch like that. They bulge like that, right? And when they stretch, they're supposed to go back to their original shape, right? But what happens from cigarette smoke, which is the common culprit for damaging your elastic fibers? If you damage these elastic fibers, it will stretch, but it's no longer able to go back. And so that's what happens. Aneurysm, you damage the elastic fibers. Only arteries have elastic fibers. So A for artery. If a patient is diagnosed with aneurysm, you know the problem is in the artery. And you have to then control the blood, the amount of blood that's being pumped out of that. So aneurysm means there's a bulging here and it's not able to go back because the elastic fibers have been damaged. And so if you have an aneurysm anywhere, don't you don't you agree? There will, because of this, so there, maybe the aneurysm is here and then it goes back to its normal shape. So because of that extra pouch there's a tendency for blood to clot over there. It may clot. So you put the patient on blood thinners, and also you try to control the blood pressure, because what will happen is that aneurysm may burst, ruptured aneurysm. Okay? So veins also have a thicker muscle layer. Thicker muscle layer. Why do they, first of all, what is the importance? What's the importance of the elastic fiber plus thicker muscle layer? Thicker muscle layer. Why do arteries need these two important features? Elastic fiber, it's a double layer of elastic fiber. And it has a thicker muscle layer. It's very good. That's right. The heart pumps the blood, right, to an artery, and it depends on this artery to maintain that pressure. See, the heart stays here. It just pumps all the way to the artery. And the artery, it's the job of the artery to keep that pressure so that my brain, isn't that going against gravity? My brain will still be nourished, and then my pinky toes, which is so far, so they can still be nourished. So this artery, the reason why it has that elastic fibers, when it expands and then it goes back, don't you think it's trying to keep that pressure, right? And then it has to contract to really push the blood. You want to keep that pressure because for nutrients to move in and out of your capillary, this capillary, do you agree? The capillary is just one cell layer thick, okay? It cannot contract, nothing. So to push nutrients in and out, you need pressure. I've never seen a glucose molecule or oxygen molecule with legs can move from here to here. They don't have legs. They have to be pushed out. What will push them out is pressure. And that explains why you have a thick muscle layer here and double layer of elastic fibers. You understand? Okay? So, uh, when we take blood pressure, we're checking the pressure here. Okay? What's going on when you check your blood pressure? You have that cuff and you're squeezing it. You're increasing the pressure out here, right in the cuff, so that what you're doing is you're squeezing this close. Your superficial arteries, you're trying to close it. So you squeeze it close. There's no more, you don't hear any sound. You locked it. And then you listen to it, and slowly you're releasing the pressure, right? So that what you're really trying to hear is you're assessing the pressure that is being generated by your artery to overcome the resistance that you just put in there. So the first sound that you will hear, what you hear is the sound of the blood that's eventually able to overcome that resistance. And that's your systolic blood pressure. Okay? There are, before I forget, so hypertension, there are two numbers to blood pressure reading, right? You have the systolic reading, which is the top number, and then the systolic reading, which is a diastolic reading, which is the lower number. Normal blood pressure, they say 120 over 80, or it depends. For you, maybe 90 over 60, 110. I don't know, right? So we all have our own set of normal values. But in general, if the number goes up 130 over 80, then they say you have hypertension. Then if the upper number is high, you're diagnosed with systolic hypertension. If the lower number goes up, you're diagnosed with diastolic hypertension. In general, the systolic blood pressure goes up first before the diastolic. Let us look at the implication of these readings on the heart itself. Okay? Look at, if you have systole means the heart is what? Very good. The heart is contracting. Very good. So if you have systolic hypertension, can you guess where is the problem of the patient? In the artery or in the heart? If there's systolic hypertension, meaning the artery, very good. You agree? Systolic hypertension means my heart has to pump stronger because there must be resistance in the output in the artery. Do you understand? There is resistance here. Maybe this blood vessel has hardened, arteriosclerosis, or maybe there is a cholesterol plaque here. So that if there's a cholesterol plaque, see, you decrease the diameter, the internal diameter, so that this one, the heart has to pump harder to push the blood out. That's what you call systolic, because the heart has to pump harder. Systolic hypertension. Where's your problem? Is it the heart? No. Your problem with systolic hypertension is your artery. Then you don't listen, right? That's why hypertension is referred to as silent killer. People say, "Oh, I'm okay, I'm okay, I'm okay," or you don't really, it's not really you're okay, but you don't feel anything. With systolic hypertension, do you agree? As long as you're able to nourish your blood, even though there's resistance, but it's still able to be pushed out. You still get nutrients, you still get nourishment. You don't feel anything. You're hypertensive, you're not even aware of it. It's not until you go for your physical exam. But look at what happens. So we remember, remember, when there's increased resistance, systolic hypertension means is the heart working harder or no? The heart is working harder. When the heart works harder, what do you predict to the muscle, the cardiac muscle? Will it get thicker or no? It will get thicker. And when it gets thicker, what do you think will happen to the diameter? Small, the space inside gets smaller, right? The space inside gets smaller. So that there will come a point when the heart relaxes during diastole. When the heart relaxes, it's not able to accommodate all of the blood that's being returned to. So now there is resistance from the heart itself. That's what you equate as diastolic hypertension. Then the heart, there's when you see this number going up, where's your problem? In the heart now. Does it make sense? So that's why when we get a systolic hypertension reading, we want to correct that right away. We want to control that. We don't want it uncontrolled because eventually this will go up. And when this is up, you know that there's already changes in the heart of the patient. That's the thing. Okay? So this is always the first one to go up. But then eventually this will follow. Because always think the heart is muscle. When there's resistance exercise, your muscle bulks up. But then there is that pericardium that does not allow for the heart to bulk up that way. It implodes. So then you end up with diastolic hypertension. It is not a good reading. Okay? And that's what you explain to your patients. Some patients, they're just not very good, very religious in taking their medication, watching their diet. Maybe if you explain to them anatomically, and I'm sure everyone knows when you exercise, you see them with the muscle bulking up. And if they realize that the heart is also muscle, and then you explain to them that there is nothing that gives it room to explode that way, it implodes. Maybe that's not a right term, implode. But if you tell them that, I am sure that they will be more conscientious in their controlling their hypertension. Okay? So you have arteries pumping blood away, 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 away from the heart. Okay? So this one is the one that generates the pressure, maintains enough pressure. It has to have that thick muscle layer because, like the blood that's going to your brain, it's going against gravity. So it has to have a thick layer to pump that. So vasoconstriction, like I said, the word vasoconstriction, vasodilation only applies to your artery. Let's look at the vein. Before we look at the vein, always the flow of blood is always depicted this way. This is an artery, this is your capillary, this is your vein. Arteries always empty not into one capillary. They always empty the blood or deliver the blood to a bed of capillaries. It's called capillary bed. Okay? First of all, another thing I wanted to know about your arteries. Arteries, between arteries and veins. Okay? Again, capillaries have nothing to do with controlling blood flow. They cannot. It's just epithelium. So they're like passive recipients. They're like passive actors. They're like watching what's going on. It's the artery and the vein that have something going on. Between the artery and the vein, I'm sure you understand if I tell you that the artery is the one that can control blood flow to any area of the body, right? Because this is the one that's delivering blood to the heart, to the tissues, and the vein is returning it back to the heart. So which of the two will control blood to any part of the body? It must be the artery. Arteries get smaller and smaller. By the time they get smaller, you call it arterioles. Arteriole. And then veins, the smaller vein, this one, before it becomes a big one, it's called venule. So the arterioles over there, by the time it gets to the small ones, the arterioles have sphincters. A sphincter is an area of increased muscle tone. So by the time but at the junction, right at the junction between an artery and a capillary, there are sphincters there. And they can constrict. When they're constricted, there's no blood flow there. You know, not all of our body tissues are nourished all at the same time. That's impossible to happen. Besides, sometimes maybe you're exercising. So most of the blood has to be rerouted to the muscles that you're using. So it depends on the artery to make sure that the blood is channeled where you need it the most. Why the artery? Because arteries have sphincters. And if you look at this picture, an artery always empties the blood to a bed of capillaries. So do you agree? Because arteries empty blood into a bed of capillaries, by the time that blood is going to be received by the vein, the pressure is way down. You have spread the wealth. So now the pressure is way down, right? So isn't that going against the the function of the vein? Look at, the vein has thin muscle wall, so it has a problem. There's low pressure. There's nothing that will help it return the blood back to the heart. This is why you have valves. The valves, what's the function of valves? It prevents the backflow of blood. Where will you have valves? Do you think you have valves above the heart or below the heart? Below the heart. Okay? So there are things, you cannot apply the term vasoconstriction, vasodilation on the veins. They do not constrict, they do not dilate. Okay? It's a very thin, smooth muscle wall. So what helps the return of blood back to the heart? It's not able to do that. So it's not able to do that. What helps in the return of blood back to the heart? Number one, gravity. For the veins above the heart, it's very easy. They just drip down by gravity. Makes sense. But then for the veins below the heart, gravity is going against it. So the veins are trying to fight the pull of gravity below the heart. That's why you have valves. Okay? But these valves are just modified folds of epithelium. That's why it's very easy for that blood to flow. Like for you guys, you're going to be working in the medical facility very soon. We used to do our medical rounds, and we had a consultant who we call her the witch because she would just discuss for 3-4 hours. We're standing forever, and we all end up having varicose veins. Do you think if you have varicose veins, that's a scary thing? Don't you think so, right? Because if you have varicose veins, that means there is an area already where there is pooling of blood. So people who have varicose veins, don't you think so? they are good candidates for thrombosis, for a clot. So I have varicose veins. I want to make sure that I'm always very active because I don't want to give it a chance for pooling. And so that's why in the gas stations there's pictures there for exercise. You want and they're exercising. Are they do they have exercise for the hands? No. Or here mostly for the legs because it's going against gravity. So you will find valves below the heart. So, and then what else helps in the return of blood back to the heart? In addition to that, is your skeletal muscle contraction. And I want you, when you open up the heart, the cat, I want you to look for a vein. The femoral vein, here, right here, is very easy. Look for a vein and you find out for yourselves if it's true that veins are sandwiched in between skeletal muscle. So that when you explain to your patients you want to walk after surgery, try to do some walking. Why? It helps in the return of blood. Why? And you're going to tell them your veins are always sandwiched between skeletal muscle. And you know that when you're exercising, the muscle contracts, and look at it will squeeze the blood. You're helping the blood, preventing it from pooling. Okay, do you agree? Okay, so it will return. But what happens to the blood when it gets here in your GI ventral body cavity? Do skeletal muscles help? No more. So here comes the importance of breathing, right? So when you breathe, isn't your diaphragm going down? You're squeezing your GI organs, increasing the pressure here. So the pressure here is going to squeeze the blood in the vein to return it back to the heart. The goal is to return that blood back to the heart. You understand? Okay? And so the normal flow of blood, circulatory flow, is this way. Normally, blood leaves the heart through an artery, then you have capillary, then vein back to the. This is the normal flow. Artery, capillary, vein back to the heart. Artery, capillary, vein back to the heart. Of these three blood vessels, let me ask you, which of the three will have a higher chance for a clot to land or to block? Very good, the capillary, right? Because this one, the capillaries, the blood vessels that you see over here, you can see arteries, veins. You will never see capillaries with your naked eye. You need a microscope to see them, meaning they're very, very small. So if I had a clot, the best chance or the best site for a clot to plug is in a capillary. So I want you to remember this one. Thrombosis. You know what thrombosis means, right? Thrombosis means a clot, right? So you have, normally we will have DVTs or deep venous thrombosis where? In your legs. This is the normal site for thrombosis because this is where gravity pulls and there's pulling of the blood mostly here. Then, why do we always, when the clot dislodges, that's what you call embolism, okay? And an embolus, always the first part of the body where that embolus will cause a blockage is in your lungs. It's always in your lungs. And I'll never forget when I was practicing in the East Coast, there's a patient who comes in, labored breathing. And the receptionist asked, "Are you okay, sir?" And he said no, and he dropped dead right there in our reception area. And the reason was massive embolism in the lungs. Why is that? So let's look at this one. So the artery is delivering blood. Let's say this is so this is the normal flow of blood, okay? Arteries, capillaries, vein back to the. I'm going to ask you this in the test. So this, can you pretend that this is your aorta, then this is my abdominal artery? Abdominal. The aorta, the arch, then the descending artery. When it goes down, the artery goes down, you call it in the thorax, you call it thoracic artery. Then it goes down, you call it abdominal artery. Then it will branch to the femoral, femoral artery. Then tibia, tibial artery, right? And then, so let's stop at the tibial artery. Then the capillaries in the tibia will nourish my muscles, let's say. And then, same name, tibial vein, but then I have varicose. So there's a clot here. Okay, there's a clot, thrombus. Then it dislodges, so it becomes an embolism. Let's trace where that embolus will go. So it will be flowing here, as long as it's vein big, right? So this is your inferior vena cava. Where is that inferior vena cava going to go? To the right atrium. Do you follow? Then right atrium to right ventricle. From right ventricle, where is it going to go? To the lungs, isn't it? Right? So this is your pulmonary artery. I'm going to draw here. Pulmonary artery. Pulmonary artery. And what did we say? Artery to capillary, right? And so it's going to go to the lungs to what? To pick up oxygen and empty carbon dioxide. So it means that there are pulmonary capillaries here, right? The pores to release your oxygen and carbon dioxide. So from pulmonary artery to branch to pulmonary capillaries. And this is the one that's microscopic, right? So it makes sense that this embolism, the first part where it will encounter any small diameter, is in the lungs. See? That's why always, and I remember asking this in the test all the way to the final exam. Why is it that people with thrombosis, their first symptom is that you worry? I think that was the question. You worry about pulmonary embolism. And anatomically, you can explain that. I'm going to ask you to write down in a flow chart the blood vessels, trace, and always remember where there's a capillary. That's the site where there is danger for the clot or a clot to form. To plug, you will plug it. You understand? So it's the same flow, artery, capillary, vein, back to the heart. Then it's going to go to the pulmonary artery, then capillary, then pulmonary vein back to the left side of the heart. But there's that capillary. So this thrombosis in your tibial, next, the first resistance or small diameter capillary is in the lungs. And what's the function of the lungs? Isn't it where you have your oxygen? And that's why you can die from pulmonary embolism. You understand? Okay? So, uh, the last part of the study of your blood vessels will be computing for blood flow, which I think we will finish up on what is today? Wednesday? We'll finish this up on Wednesday, on Monday next week. Now I want you to open up your can, okay?